Hello, everybody. I am Megan Heffernan at Dr. Jackie Jung and Associates. I am here with Mitchell Davenport, who's
Cool.
another clinician here, and Dr. Jackie over here, who is a psychologist. Today we have a topic of play therapy, or well, not play therapy, but therapy using play, or play that is used in therapy, in the therapy setting with mostly children. And so play and games can be used in therapy in both positive and productive ways, yet many parents have come to me, or I have heard just even in the community, why is my kid always just playing? Or how come every time after a session they tell me that, they were just having fun and doing these games? I thought they were here for therapy and for learning things. And it's hard to quickly give a parent an answer to that, because the simple answer is yes, they are playing in therapy, but there are many therapeutic reasons why we are playing in therapy. It is something that is used purposefully to help teach different skills and practice things with their child in their session. So before I get further into this, Jackie is going to give a couple disclaimers.
Right. I just want to add it on. The play therapy or therapy that utilizes plays. What we're talking about is in our own session that we have developed throughout the years, throughout the experiences, based on theories, different theories. And everybody has different approach and theories.
Right.
Somebody use more this way, somebody use more behavior therapy. So that represents our speeches, represents our own experiences and what we believe would be effective. So it's not like a universal representation that, okay, all the therapy, play therapy should be like this, should be the same. Of course, we have similar theoretical background why play therapy is important, but we applied it out, we utilize it in different ways, our own ways. So we're just trying to go through everybody and see how everybody, uses play therapy in their session differently. I think it'll be helpful for the clients to know.
Yeah. So the first thing that I wanted to go over is just some different aspects of play, or different type of play. Play can include things like arts and crafts, or sitting down with a kid while they're working on pictures. They can draw pictures of themselves or their family or things that they're interested in. Play can also be board games or other types of games that you are interacting with the child with. It can include puppets or other characters, people, or dolls that are used to do more interactive kind of play or role-playing different scenarios. When play is used in therapy, it benefits both the clinician, the client, or the child, and also it can benefit parents. Sometimes parents will be involved in the sessions, and sometimes sessions will be just one-on-one between the clinician and a child. From the perspective of a parent, why play can be helpful and useful is that it can be used to either build, repair, or strengthen relationships with their child. It can be used to practice positive interactions or positive parenting tactics. And it can also help a parent with communicating with their child. Typically with adults, we communicate mostly through verbal means in therapy, but with children, they don't have the same capacity, or sometimes just not the same interest in being able to express themselves only verbally. So by utilizing play, it allows a child more opportunities to express themselves, their experiences, their thoughts, their feelings, etc. For a therapist, when they use play, it is a really wonderful opportunity to build trust and rapport, especially in the beginning sessions with a newer child client. It also can help create a sense of safety and fun, or a familiar environment for them. If you're bringing a small child into a therapy room that doesn't have any toys, it can feel kind of like going to the doctor's office, and that can give them a negative feeling or a feeling of discomfort. It can also make them more shy to talk and open up. Whereas if you are playing with a kid, that's something that they're more comfortable with, might just relax, have more fun, and they're more apt to open up and talk about things verbally and through the play. It also can help with building familiar rules and expectations for the child, and to also help practice learning expectations and rule following, those types of things. when a therapist is playing with a child, they can learn a lot about the child's interests, their family dynamics. It can give them insight and understanding to the child's skill deficit areas or other problem dynamics that might exist within the family, or for the child at school, or when they're interacting with peers or their siblings. And it can also give a therapist more insight into how to utilize those things or leverage the skills and interests or the strengths of a child while working on different interventions or building different skill areas. For children, I already mentioned that playing can be fun and can give them a familiar and comfortable environment, which also allows them the benefit of one-on-one attention. Many children are starved for a one-on-one attention, especially if they have a busy household, busy family, many siblings. They don't often have regular time where they have one-on-one attention from an adult figure. It allows them to express themselves and process their different experiences, and it also helps them with building and practicing different skills and abilities. Just yesterday, I was working with a 9-year-old girl, and I told her that we were going to do this video, and I said, can you tell me from your perspective why it is that we play when we are in here, or what it is about playing that is helpful to you that I can share with others? And she said, and I will quote her, "We play in a way that describes our day and lets us talk about it through our play so kids can have fun yet learn too." And I thought, well, that was
she's pretty
I think that was, expressed maybe even better than I have been able to put it into words. And she also went on to give more examples and specific reasons why it was helpful to her. The last thing that I want to do is just kind of give a list of different skill areas or intervention areas that might be worked on during play. One being attention and focusing skills, problem solving, conflict resolution, healthy boundaries, interpersonal and social skills, communication, self-expression, anger management, emotion management, esteem and self-worth, distress tolerance. And that one, especially when I'm playing some board games with kids, I'll notice if they're not winning, they can start getting frustrated. So we can time out, we can practice some deep breathing, or we can talk about if they're with Mitch,
are you talking about therapists?
I'm talking about the client, the kid.
Yeah, but it allows opportunities that are built in right there to practice during real, situations, how to handle different things that might come up, difficult emotions, or how to express themselves or their need or what's going on in their head. It also can help with motivation, impulse control, and in general, healthy coping mechanisms.
Very good.
Yeah. I'm not sure who's next.
Jackie, you going to go next?
Sure. All right. Sure. Just linked to what Megan just said about identifying children's, because I do a lot of assessment and evaluation, so I think part of the evaluation is to watch them play. Whether you're participating is part of the treatment therapy, and evaluating is you're observing kids play. So there's a slightly different, doing evaluation, so-called evaluation testing versus you're doing play therapy. That is the therapy work versus I'm just observing in a neutral setting. So you can see how kids' personality, how they behavior pattern, the communication, how they solve problem solving through observing them play, because it's really a relaxed setting. It's not like you're sitting here talking one-on-one and then the kids are all nervous. What should I be saying? But when you play with them or you observe them play, they really relaxed. And then you can see their so-called true color. So some kids want to win, as Megan said. Do they cheat in order to win? And then what does cheating in winning, in playing board game, you cheat. So what does that show as a kid's personality?
Right.
Do they do that in other settings as well? So that's, as my evaluator perspective, that's what I'm thinking, documenting and thinking. Sometimes, when we play a game, I lost or I missed so many pieces. You lost a player, I can't remember exactly. And then the kid actually said, well, Dr. Jackie, do you want my soldier? So that is like, I don't want you to suffer. I don't want you to lose. So how about I help you win type of thing. So we both win type of thing. And what does that show a kid's personality? So can you see that dynamics and personality behavior pattern outside of my session? Yes. With her peers or his peers. So these are things for evaluator, I think is very precious and important. But today we're talking more about in the therapeutic session, how we use play to promote a relationship. And that's, in my opinion, that's one of the important thing why play therapy works. Is one of them important thing is to establish therapeutic alliance with kids. Talk therapy is not super helpful for kids younger than 10 even. You want to play with them so they relax, they trust you, build trust, build likeness. And then they open up, and then you can observe them and how I'm going to work with that type of thing. And again, I mentioned in previous videos, discipline is not effective without bonding. If you don't have a relationship, especially with step family, you don't have a relationship with the child, it's not going to be very effective for you to discipline the child. Right. Just like in therapy session, if a therapist does not have a relationship with the child, bonded a therapeutic alliance with the child, your therapy is not going to be very effective. So we use therapists to, while working with the children, utilize a lot of play because you want to establish that rapport, right? So that's one of the things. And then in previous video I had talking about the 3 domains of effective parenting. One of them is play. There are nurture, there are discipline, and there is a play. So you can watch the previous video about how to establish those effective parenting skills through play as well. Let me see, and I want to cover a little bit. Probably Mitch is going to talk about a little bit more about the methodology of play. One of them is parallel play. Parallel play is you just sit next to each other. You focus on something else. They're paralleling your attention. That is not effective, according to the research, as effective as interactive play. So you're facing each other doing a board game, okay? And then you interact with each other talking like this instead of this. We're both watching TV, both playing video game. Yes, that is interaction in a way because we're talking, we're sitting next to each other, but our attention is paralleling to certain things. Okay, so that's one of them. You want to do a more enough interactive, face-to-face type of thing. Let me see. And as play starts in therapy session, depending on the personality of the child, usually I will start with the non-directive and let the children pick their activities instead of directive. In some cases, I will go directive right away, but in most cases, I will let the kids lead. And see his or her pattern, what type of toys they pick, and I'll go with it because that's the first thing. You don't want to get kids involved, but you do this and do that, and you're doing exactly what their parents tell them to. So you want them to tell you what they like to play, dollhouse or board games. Some kids just, even they're 8 years old, they don't like board games. They want something different, So I will let them play first, and then we'll figure out our own unique way to connect the bond with each other. And sometimes kids will always pick certain games every time they come here, and they always want to win. So my last point I think I have, and it's boundary setting, as Megan said, during play, you can set the boundaries, and it's important for therapist set the boundaries. It's not like, okay, non-directive play is good, but it's not like you can do whatever. I've had kids come in here and destroy this play therapy room by throwing stuff, breaking stuff. You can't just let it go. Just like at home, they can't destroy the home or toys. So when sometimes kids get excited, so they just start throwing stuff. And how you handle that, whether it's parents or therapists. In my therapy room, if the kids get it a little bit over, I've had a kid that throwing toy, like bang a toy on my head, and I would say, stop, don't. And it's easier to set the boundary again if you have a relationship with the kid already. I said, stop, don't do that. And then you go back to playing again and be happy and stuff. So you want to correct them, set the boundary, as Megan said, during play. And you want to afterwards change the tone and have fun, so the kids don't feel like you're only set the boundary or you only have fun. So you want to balance these two. Again, back to my video: discipline, nurture, and fun. These are the 3 things with the kids, developing a kid's skill. Very important. I think applying skill, my last point is applying the skill. So the kids learn these things through 1 hour interaction with the therapist, and then they apply these skills when they play with peers, their friends outside of the therapy session. So that's how why play therapy is effective in working with kids with the emotional behavior problems, because this is a small setting. The kids will be nurtured, disciplined, supported, and so they can go outside, to do a good job. Okay.
Yeah, I think that's a really great last point that Jackie had. The same 9-year-old that I used the quote from, part of our conversation was about how what she has learned through our play and our sessions, helping her in her peer interactions or interacting with others at home and at school. One of the things that she likes to do is play with either figures or dolls or puppets, and then we will act out different scenes that involve a family unit and being upset about doing homework or at school, and these peers not liking someone. And so we use the puppets and the characters to kind of go through those scenes and practice how she can interact differently or how to handle the different situations that come up. And often while we're playing, I have noticed that she would say, okay, now pretend this, have your character do this. And that, I know for me, that's okay. I don't mind. But if she was interacting with a peer and trying to play with a peer, that's really frustrating. Usually other children are not going to want to be told how to play or what their character is supposed to do. So we've been practicing on her using only her characters to create what she wants to have happen, so that when she's with her peers, she's not telling her peers, okay, do this while we're playing. Yeah. And I asked her about that yesterday, how that was going, and she got real excited, had this huge smile come over her face, and she was like, yes, it has been helping. It's been different. More, my friends have wanted to play with me more. And that was really exciting for her to share that with me, and it was really exciting for me as her therapist to hear that.
Yeah, that's cool.
Yeah.
Wow.
Yeah.
Okay, well, I don't have a whole lot to add that's different from anything Megan and Jackie went through, but just to highlight a few things from my perspective. You quoted, was it a 9-year-old girl you said? Megan quoted a 9-year-old girl. I'm going to quote the philosopher Plato. He was a Greek philosopher about 400 years before Jesus was born. And here's what he said about play. Now keep in mind, 400 BC, thereabouts. He said, you can discover more about a person in an hour of play than in a year of conversation. And both Jackie and Megan touched upon the assessment process. That comes primarily, there's actually two kinds of play. There's directive play and non-directive play. But I like to call my non-directive play organic play. And the reason I call it organic play is just for my own thinking, because it's something that grows naturally from the child rather than something that I'm directing, you should do this or you should do that, or please play this way, or whatever. Again, we have to set limits sometimes, but I'm talking about in terms of what we play or how we play it. Organic play lets the kids take the lead. And I think that's probably the most important thing about play therapy is the relationship. I mean, there's techniques, there's things we look for as they went over, but the relationship is so important. And that's what I like about organic play, is it gives a chance to develop kind of a natural relationship with the child and see how they interact. Do they try and include you? You're trying to let them choose, but they want to include you. So then I might go ahead and go with it and do what the child wants to do, because that was what grew out of their inner world. Let me just give an example of this. Many people have heard of the Rorschach test, and it's something that psychologists, or I suppose at times psychiatrists, used to use it. I don't think they do a lot anymore. But anyway, the idea is the psychologist will hold up an ink blot and ask the clients what they see in that ink blot. And the therapist or psychologist would go through a number of ink blots and then would draw some conclusions about the client's personality and their characteristics, etc. by what they described they saw in the ink blots. So the issue was the ink blots weren't anything in particular. The client projected from their inner world onto the ink blots and came out with, well, I see an angel. I see a devil. I see a monster. Why does a child see a monster rather than an angel? What's going on with that child? Is there anything going on? Should I follow up on this, or is it, quote, normal? So a child's environment is what I'm getting at. A child's environment is his or her ink blot. They try or the therapist tries to let the child play, and from that they take their environment and they create it according to their own inner workings in their own inner self. And so again, the assessment, I'm sorry, stumbling here. The assessment and the importance of the relationship, I think, are two really important things in organic play. It gives a child a chance to work out their problems. This was a long time ago, but if you remember 911, which I'm sure most of you do, 911 was very traumatic for a lot of people, and I felt like I was kind of traumatized just from watching it on TV. Well, I had an 11-year-old boy that I was seeing at the time, and it was just a few weeks after 9/11, and we were engaging in play, and even though I'd been seeing him for a while, I tended to let him kind of choose what we played. And what he did was he kept building towers out of Legos and taking a toy airplane and knocking the towers down.
Right.
And he did that repeatedly through play. It was almost an obsessive compulsive sort of thing. Well, what he was doing was working out the trauma that he experienced with the planes hitting the towers and the towers falling. So again, the child imposes upon their environment their own inner world. Directive play, I think that was covered real well. I don't have really a lot to add to that. I would just second something I think, Megan, you said about sometimes including the parents. Mm-hmm. And I do that for a few reasons. Sometimes I include the parents because I want to play with the child and I want the parents to see how I play with the child. Not that I'm perfect or do everything right, but get some ideas on maybe a different way from what's their normal way of doing it. So there's including the parents for that, but it also sometimes helps develop the relationship with a child with social anxiety or different reasons they don't want to stay and relate to the therapist. So I have a child like that who so far hasn't talked in session. And so his mom and I and the child played Chutes and Ladders. And while playing Chutes and Ladders, he was comfortable because mom was here. But he started talking and he got more relaxed. And there was something about that made him feel comfortable with being here. So I think that's really important as well. And lastly, I just want to touch base about 3 different types of play that when I was a evaluator, a consultant for Head Start, they were very interested in, because they felt at the preschool age the child generally developmentally should be starting that transition from parallel play to being able to play cooperatively with another person. So that brings up for me the thought that, and again, this is not a criticism, but a lot of times I find that parents don't really understand the developmental levels of their child and often have expectations of their child that are really something that would be more appropriate for an older person. Or maybe they see the child just as a little adult that's just like adults. And I think it's important in therapy and in play therapy, one of the things we're doing is we're saying, is this child on track developmentally? Not that that's technically probably a mental health issue, but it has a big impact on mental health in various ways. So thank you very much for watching. Does anybody else have anything to add?
I just have a quick question as you were talking.
Okay.
So this question is just for us to brainstorm. It's not something, we listed here. I just suddenly think, would a therapist, maybe it's more therapeutic related, would you correct the parents if you didn't think they were doing their effective way in playing with their children in your session?
Only after I feel like we've developed a therapeutic relationship, the parent and myself. Then I would correct them if I felt confident that we have a good bond.
Right.
If we were still getting to know each other, unless it was really totally out of line, I probably wouldn't say anything. I would wait till the relationship.
So you're thinking more like
developed.
a negative, it's a negative thing, type of thing.
I guess that's what, I thought that's what you were asking.
Right. But you can give feedback.
Sure.
Feedback sometimes it could be negative.
Sure.
That's feedback as well.
Well, and it can also be, I'm just making an observation. This isn't a judgment or criticism,
Right.
but I noticed X,
Right.
Y, or Z,
Right.
and try and approach it that way. I have a client that I do that a lot with. I developed a relationship, or not a client, I'm sorry, a parent. I developed the relationship, and then I spend a lot of time with the parents on how to play with their children, how to work with their children. In doing so, would I? Yes, I would correct an adult. I don't think I'd call it that. Mm-hmm. I think I'd call it, again, I'd go back to making an observation, and I call it, I guess, the Columbo approach. If you're old enough to have watched Columbo the detective, he was kind of a bumbling detective who always acted like he didn't know what he was doing and put people off guard, but then he'd solve the case. And so I play Columbo a lot. It's like, well, I noticed thus and such, and I was just wondering if, and then kind of let that be the opening to difficult conversations.
Mm-hmm. How about you, Meg?
I agree with Mitch that I wouldn't frame it as a correction for parents, and there's many, many ways to be a healthy, positive parent. There's not just one right way.
Yes.
There are some things that I would confidently say this is not correct or this is not healthy, but I do try to shy away from that. And outside of those extreme situations.
Right. You can't hit the child when you play.
Right, exactly. Right. But so instead of focusing on what the parent's not doing well, I focus on what they are doing well and try to point those things out and really vamp that up. I also will refer back to what the goals are for the client. And often one of the goals does include what the parent wants to see, or that the parent would like to see their child, better with their emotion management or respecting their rules in the house better. And so during sessions, if parents are there, I can help point out when you interact with your child in this way and they're responding back in that negative way, that oppositional way, or in this disrespectful way, it may be because of this or that on how you approach the child, how you handled that. If you were to try this, how could that maybe change the outcome? And so then we can practice those things using games, using play, and they can see firsthand the differences of different approaches, and then utilize those outside of session also to get more of those positive reactions from their child. And that has led to parents often then at a later date coming in and saying, okay, so this is going on, what do you suggest for this? Because they start building confidence and trust in the therapist or the clinician, or in the process that therapy has shown them.
Yeah, very good.
Well, we're trying to keep this reasonably short, but I'm getting excited now about play therapy. I mean,
I know.
Seriously, it got me really thinking about it. What do I do? How do I believe? What do I believe works? How do I?
There is a theory says that play therapy also is a therapy for therapists themselves too.
That could be.
Yep. One thing that I thought about mentioning is that usually when we're talking about play in therapy, it is with children. But I do have a lot of teenagers, or even sometimes an adult, where we will play something. It's usually not the dollhouse, but we might play a game of cards while we're talking, or color a picture while we are talking, and it can be very effective, not just for kids, but also for older clients. And yes, also as a therapist, I enjoy the sessions where I'm playing. I had a kid that brought in these little dog figures that had these balls that went in the mouth, and then you could pop them and they would shoot, they would go flying. And so we were having this essentially like a Nerf war in this play therapy room the other day, and it was one of the best sessions for both of us. We definitely bonded a lot, and we talked about all kinds of skill areas, especially with boundaries. You can shoot it toward me, but you can't shoot it toward my face, or you need to stay at least this far from me while we are playing this, otherwise it hurts when I get hit with that ball. So it was both really fun, but also still very therapeutic, and we practiced a lot of skills that day.
Some limits.
Those are the moments that the kids would remember, about what they have experienced with their therapist.
Yes.
When they get older.
And you know what I think of when you say that, Jackie, is that we may not feel like we're really making much progress with this child, but maybe when they're an adult sometime and they're having problems, they'll think back to playing with that one therapist in the playroom and think, oh, you know what, maybe I should give it a try as an adult.
Right, and it's important to me too. Sometimes maybe it's from a self perspective, but sometimes the experience that we are able to give to our clients also is very rewarding to us as well. I can't represent everybody, but at the same time, yes, I do have moments that when I drive some toy store, I simply drive home from work, and I was thinking some moments that years ago that it just triggered for some moments like, oh my gosh, that kids did this in my session, and just laugh and giggle. Those are the things that it's actually deeply impacted me as well. So in this opportunity, I want to thank all the kids that I worked with as well. You guys did impact us, our lives as well. So thank you for that.
Yeah.
So, all right. Yep, we had a great session today.
I just got an idea.
Yeah.
I think next time we should not prepare individual presentations. We should prepare, we can prepare, but we should just have an open discussion. I really like this. I think it flows nicely. Yep. And we don't have to worry about remembering what we wanted to say because we're saying something in response to something here and now.
Right.
So just a thought.
We'll do that. That's what I was thinking too. Next time that we'll do some free flow question, Q&A and stuff.
Yeah.
Alrighty. Thank you everybody for today's video, and if you like it, give us a like. Thank you.
I'm talking fast because I was like, I'm going to keep this succinct, but then I'm just not being clear, and I'm doing a lot of ums and like run-on sentences. Do you know how to cut it?
Yes.
Okay.
I'll try my best on the computer.
Part of my problem is like everything from my session is still in my head. Okay.
You're a good therapist, so you can just wing it.
Being a good therapist does not mean that you're good at making videos. Okay.
You pick the topic. Just
I know. Okay, cutting back in.
And I just forgot what in the hell I was going to say. I may not know what.
The 3 types.
Yeah, but...
What's a chroma key?
I have no idea.
I don't know either. Gosh, these are like how smart us.
Is that software that came with the camera?
Right, it does. So frame rate, exposure. I don't know what it does.